Documenting vital signs and I's and O's can be done by the work list. The intake and output will display at 0600 and 1800 every shift. You would need to put in every event separately, as far as if they had 2 bowel movements throughout your shift, you would need to go ahead and document each one as a separate event. It does not allow you to put in both events all at once in one session. If you need to enter more intake and output besides just the one time, obviously, you would need to be able to go to the unscheduled documentation and go to your intake and output to document that information. Here's your I&O right here, number 103. Please note that if you are documenting the patient's diet, or if you are documenting in your shift assessment how much fluid was taken out of the bulb of a JP drain or any other kind of item like that, you would document that within that screen, and that will automatically go to the I's and O's. You do not need to enter it in separately. This is only if you have any events that were not documented within another screen. So I'm going to go ahead and document an I&O. It will default to now. That's fine. You can always back time it if you need to. And then I can go ahead and it drops me into documenting the intake for any IVs. If I'm not documenting that at this time, I can go ahead and say not applicable, say OK, and then I can jump into whichever one I want to actually enter. So I can put intake, I can document any output with these categories. Tubes, drains, and dialysis output are in their own category. So let's start with the intake oral, just so you can see what that looks like. And I would click into that field and click on document oral intake. Then you would go ahead and put in mLs how much this patient drank and what they drank. So maybe they had some water and they had some Jello. And say OK. Say OK one more time. You can enter multiple entries if you want to on this one. Otherwise, just say OK one more time, and it will take you back to the screen to be able to document. You don't have to put any information into the output, or vice versa. You don't have to put intake if you're just putting output. None of these are required fields. It just is your option to be able to do either or. So I'm going to go into the output for these types, and it does give you the warning about not double documenting if you've already done it in another screen. Here you have the different types of urine, so that way when we actually look on the I&O display right here in the middle of your shortcuts, it will show you the documentation of how that was entered, whether it was output with a Foley or it was just a void. So I'm going to go ahead and document that I emptied the patient's Foley. So I click on that particular item, document the urine from the Foley, and enter the amount. Hit enter, and then you can document whatever character descriptions you want to put in. Enter one more time. You can put in multiple types here, so if the patient had a bowel movement along with the Foley drainage, you can put that in as well. So I'm going to say this was formed, document. I would then be able to type in the letter that's in the parentheses. Obviously I'm not going to measure it, so I'm going to go ahead and just use one of these alpha letters. I'm going to type M, hit enter, and the description. If the patient had an emesis, you'd also be able to click that one. Here's your document emesis, and again, you would be able to enter an alpha response. You could also put in any descriptions, precipitating events, and relief measures that you put in. If not, just hit enter, enter, and I'll show you with the tubes. Here's your Blakemore, chest, esophageal, feeding, gastrostomy, jejunostomy, etc. I'm going to hit back to come back here. Drains and dialysis, you'd also be able to document any other drain information if it's appropriate for your patient. Again, if you documented this in your shift assessment, you don't need to do this in the screen. So I'm done putting in my intake and output. I can go ahead and say OK and accept. To view the I's and O's, you would simply go to your I&O display, and here you would be able to see my shift. I can see there's the 150 I entered, my urine output, and bowel and emesis are put together, but you can see that I have in parentheses the number 2, meaning that I have 2 events. They do not calculate into your balance at the very bottom. It is simply, this is 500 minus 150, and I get negative 350. But I can see that I had 2 events of a bowel movement and an emesis. If I want to see what the documentation is that is tied to this to see which is which, I can click on this button called Review Assessment Data, and it allows me to view all the documentation I just entered. Here's the bowel movement, here's all the documentation I did, the character, here's my oral intake, and the emesis, and that we didn't collect anything for the parenteral IV. Click OK. It brings me back here, and I can go ahead and back out of there. Now the vital signs are usually sent over with the Icerona vital signs if you're in ICU or DOU. If you're in Med-Surg, it also sends it over if they have set that up in the Welch Allyn machines. They have to scan themselves in and then go ahead and connect the patient by scanning the patient bracelet and then taking the vital signs. That's how it knows where to send those vital signs. Once they come over, then you would be able to go into Icerona and accept them into the system. If you just want to put in a set of vital signs without using Icerona, you will see it also show up on your work list. You can use the full set of vital signs here. Also in the unscheduled documentation, if you scroll all the way down, it will give you a section here for individual sets of vital signs, as well as the orthostatic vital signs if you needed to document them sitting, standing, and lying down. So if you wanted to go ahead and enter a full set of vital signs, you can either take it off your work list or come to the unscheduled procedures and pick them out from there. I'm going to say now, and I can go ahead and put in whatever information I want entered. So put in my temperature, how did I take it, and pulse, description, respirations, again the description. I can do multiple or I can pick one, it doesn't matter. And then here's your BP, and you would put with the slash, and then again the description of which arm it is and whether they're sitting, standing, on which side, etc. Oxygen saturation, and if it's on room air or supplemental oxygen. If it is on supplemental oxygen, you would want to select that one, as well as the blank liters per minute and how is it being delivered. So you would say via nasal cannula or simple mask, whatever's appropriate. You have options down below. So I can pick multiple things off that list, say OK, and then I would go ahead and define how many liters per minute my oxygen is flowing at. You would then be able to document the pain level. Click that and select the pain scale you need to use. I'm going to go ahead and put number 2, enter. Again, you have your comment section if you want to put any comments, but I would go ahead and hit enter and accept. Remember, if you need to edit your vital signs or your intake and output for whatever reason, when you go to the work list, I'm going to close this and open it again. You go to your expand in the bottom right hand corner, and you will see any completed documentation that was put into the system. So here I can see there's my intake and output, and here's my vital signs that I entered. You can see they do say complete, and they are in blue. If I need to edit these, just double click the item and click the correct supplement document and either correct it or that you're going to add something to it. And then you would go ahead and go back into that screen and make whatever changes that you want to. Say OK, one more time, and accept. And once that happens, then it will go ahead and update. You'll also see instead of complete, it says corrected. And if I go to my vital signs trend, you're now able to see the correction that I did, as well as all the other vital signs that were entered.